The difference between ADD and ADHD. Attention deficit disorder is known as ADD, and attention deficit hyperactivity disorder is known as ADHD. Many children are diagnosed with the disorders around school age. It's also very common for ADD and ADHD to be diagnosed in adults too. These are indeed two different types of disorders. There are very distinctive differences between ADD and ADHD, although they appear to have similar symptoms. ADD is predominantly inattentive symptoms. ADHD is predominantly hyperactivity, impulsiveness, and inattentive symptoms. Adults with ADD will have problems focusing, easily become bored, or seem to process things slowly, and experience trouble in following directions. A person that is impacted by ADHD will show a lot more hyperactivity and impulsiveness, such as the inability to sit for short periods of time, become very fidgety, constantly talking, and saying very inappropriate comments. Many people may not show all the signs of ADHD but still have the disorder. It's not unusual for the symptoms to be missed in adults. The person may seem inattentive, quiet, unfocused, or even lacking in hyperactivity. There are several treatment options for predominantly hyperactive, impulsive, inattentive, and other symptoms of ADD and ADHD. The medications like amphetamines have been very helpful in easing the symptoms of the disorder. They work well on one of the symptoms of ADD and ADHD. Medication for ADD and ADHD will be a stimulant, such as methylphenidate. It is used to reduce the inattentiveness in patients. Antidepressants like fluoxetine or sertraline will help with concentration. This is very important for school-age children, but some parents are uncomfortable with giving their kids stimulants. Clonidine and guanfacine are helpful in easing anxiety and impulsive behavior. It's recommended that people receive behavioral therapy too. This will help children and adults cope with the disorder in social settings. Many people do react to medication very differently. Most physicians may make adjustments in the medication for ADD and ADHD patients in order to find the right dosage. People diagnosed with ADD and ADHD will need to take medication on a long-term basis. One important note about ADD is that there are 6 different kinds. Many people don't realize this and think that they can treat all cases of ADD with the same methods, and this is untrue. The doctor should treat each case individually by looking at the symptoms and issues affecting the person before prescribing any kind of medication. Get your free copy of the video, The 7 Myths That Your Doctor Doesn't Want You to Know About ADD, by going to www.learnaboutadd.com.